for clients who have a history of trauma, it's even more
Yeah.
important because a lot of trauma, in my opinion at least, damages trust. At some point in the trauma experience, there was some loss of trust or breaking of trust.
Right.
Trusting that your home was safe, trusting that the relationship was safe, trusting that your workplace, whatever was safe, the world was safe.
Yeah. Hi everyone, welcome to today's episode where we do everything trauma talk. My name is Chantaeu Munroe, CEO and founder of CKM Healing Consultancy, where with a little care, we kindle the mind for healing. Today we'll be interviewing a phenomenal psychologist who will be talking about how counseling helps person to heal from trauma. Today we have with us Jhanille Brooks. She is a rehabilitation and mental health counselor for the last 15 years, or she has been practicing for the last 15 years. She is the founder of the Jamaica Mental Health Advocacy Network. She practices in all things mental health, and I'm so happy to have her with us today. Jhanille, thank you so much for coming on board with us to talk about counseling and how persons can benefit from counseling to help heal from trauma. So let's jump right into it. How beneficial is counseling to help persons heal from trauma?
So counseling is important for everybody.
Yes.
Let me just say that. I think we're at the stage where we recognize the importance of counseling for everyone. Just like life issues, work issues, family issues. Life is life, so I think we all need therapy, right? But it's even more important for people who have been through trauma, because trauma tends to have a very extensive impact on persons. Impacts their body, their physical health, their mind, how they relate to other people. Right. So because of the impact of it, I think counseling is extremely important.
Yeah.
And having the right kind of counseling, like trauma specific, trauma focused, trauma centered counseling, I think is very important.
Right. And with that said, it kind of jumps into my next question. With trauma being so dynamic and multifaceted, how do you integrate the various counseling modalities to help to treat person?
So I think it's important to have a very broad view of the person's history and what they've gone through, doing a very comprehensive biopsychosocial assessment. Yeah. And I think that gives the therapist a better idea of how to approach that client specific. Yeah. So even though we have certain evidence-based practices that are for trauma, I think which one you choose or which techniques you use, I think really has to depend on that individual client. There's no one-size-fits-all approach to trauma, I think, because trauma is very subjective. So what I find traumatic might not be the same for somebody else.
Exactly.
And vice versa. So I think because it's so subjective and so dynamic, like you said, you have to have a very open yet comprehensive approach in choosing how to deal with the client.
And then naturally trauma affects everybody differently. Like I might drop and buck my toe and I'm fine, but somebody else might be traumatized to go around benches or whatever it is that they had that experience with. So I completely understand that too. Doing counseling, I mean, having done it myself, I know, and aspiring to be a counselor myself, I know it's very important to set up a safe and supportive environment for each client. Can you say why that is?
A safe space is important for all clients, but I think for clients who have a history of trauma, it's even more important because a lot of trauma, in my opinion at least, damages trust. At some point in the trauma experience, there was some loss of trust or breaking of trust. Trusting that your home was safe, trusting that the relationship was safe, trusting that your workplace, whatever was safe, the world was safe.
And
there is a loss of trust, and therefore having that safe space is important and building a strong therapeutic alliance
Right.
so that the client feels safe to share certain things and
Yeah.
to allow the process to work. So in my experience, sometimes working with trauma survivors, you spend a lot of time,
Building
like maybe the first 4 or 5 sessions, just trying to build rapport and build that kind of connection and ensure that you're communicating that safety to them, whether or not they are open to receive it at the time.
Right.
And just being patient with the fact that it takes a little time for the layers to unpeel. So it's super, super, super important for trauma survivors.
What's the typical time, or what have been your experience with building trust with persons? Because you mentioned a while ago the first 4 or 5 sessions. Have you ever had sessions go way beyond that just to build trust?
I think working with teenagers, I think that really tests your skills, in my opinion, right? So I think when I work with teenagers, what I realize is that there is a gradual unpeeling. So they may come in, and of course, if they're forced to be there or sent to be there, they're there against their will. They come with all of the guards up, all of the walls up, and then you have to use little tips and tricks to kind of start to build that rapport, and slowly but surely, the layers peel back. I mean, I've had clients who have waited 6 months into therapy to reveal something like really big. And then I remember, for example, a recent client said, I was waiting for a while before telling you this. I just wanted to make sure I was comfortable. And in my head, I was like, girl, I've been seeing you for like 1 year. Like, what are you saying? Yes.
Wow.
Yep. So it was, I found that very interesting because it was literally 1 year. Now we've been seeing each other.
1 year is a long time.
And, when for her to say, I was just kind of waiting a while, that means that for 1 year, essentially, she was testing the safe space of our therapeutic alliance to see if it could manage.
Right. Which I guess makes sense because trauma leaves traces. And even though some instances of trauma happens in one moment, it stays with you for the rest of your life. So, I mean, I'm saying that 1 year is a long time, but given, I guess, the magnitude of what had happened, it's important that, and so with that being said, safety, surroundings, feeling trust, what role does mindfulness and awareness play in someone's healing journey?
So mindfulness is something that is fairly new to the space, meaning it's been around for a few decades, but it's taking off now. It's kind of more of a buzzword. Everybody's talking about mindfulness, which is good. So I think it's important to teach our clients skills that they can use in real life. And I think mindfulness is one of that, of those skills. And for anybody, I think it's important. I think for trauma, it is a little different in the sense of, depending on the kind of trauma, persons who have been through trauma tend to be hyper aware, or sometimes they're numb. So once again, going back to what I said about tapering your approach based on the client's history, mindfulness and like awareness of mind-body connection, for example. Somebody who is hyper aware may already be very much into their bodies and very much into noticing every little change in their bodies or physical sensations. So in that case, you might want them to, let's just say, be less aware, less vigilant. And then there's some people who, because of their trauma, they tend to be in their minds a lot. They tend to be in the past a lot. So mindfulness, promotes staying in the present. So of course that would be very helpful. So I think mindfulness is a great skill, a great practice. But I just think for trauma, because trauma is subjective, where you introduce mindfulness and how
Right.
is dependent on the client.
Right.
Yeah.
Yeah. Sweet stuff. And I guess, not I guess, that is why persons need to visit a trained and licensed professional to exercise these techniques, because it does not seem like a one-two thing. And if you don't know what you're doing, you can completely reset somebody to that horrible experience, and we
Yeah.
don't want that.
Re-traumatize. Yeah.
Re-traumatize, that's the
Yeah.
word I was looking for. So with that said, could you give examples of how utilizing the different techniques have evolved in success stories?
Mm, for me personally,
Good.
I mean, so I very much believe in referring to specialists where it is applicable. So, for example, all of my, well, not all, many of my clients who have trauma in the form of abuse, whether sexual or physical, some kind of assault, I tend to refer to somebody who specifically trained
deals with.
in trauma. And in that case, many times I refer them to an EMDR specialist.
Okay.
If it's grief and loss related, I do the appropriate referrals. If
Right.
it's like complex grief or complicated
Right.
grief, so it depends on what comes through the door, so to speak. So grief therapy, I think, is very important. EMDR, somebody who is trained in particular techniques, because in a way, I think it's getting the best bang for your buck, because trauma and working through trauma can take months to years because of the need to build the trust and the extent of the trauma, etc. And I feel like going to a specialist who is specifically trained in an EMDR or a grief therapy is better value for money. Really, because the average Jamaican cannot afford to go to therapy for 2-3 years.
Yeah.
They can't.
Yeah.
And most of the time the trauma has limited your day-to-day activities, your physical health, your mental health.
Right.
So going to a trained specialist gives you maybe a shorter time period to work with. Not to say that the healing is going to be overnight, but it may come faster with a particular technique rather than just general counseling.
Right.
Does that make sense?
Yeah, it does make sense. It does make sense. In another episode where I was talking to another psychologist, and she was sharing how she does and how it just gets straight to the point, because it deals with the source, which is the brain most of the time. And then for others, they might just like talk therapy. But for more complex things, I can see how you'd want to go to a specialized person for that specific thing, as opposed to drawing it, right? So it's
just the same way as if you had a heart problem, you go to a cardiologist.
Exactly.
Instead of going to
general
the GP
practitioner.
over and over.
Exactly. Well, thank you so much, Jhanille, for discussing with us the benefits of counseling and helping persons heal from trauma. How can persons get in contact with you? I'm
on TikTok.
I need to go on TikTok. I'm not on TikTok.
I'm on social media, Instagram and TikTok at Just Keep Swimming 876.
Oh yes, Just Keep Swimming.
Yes, and then I can be contacted at 839-5123.
Okay. Well, guys, there you have it. Counseling, trauma, therapy, healing. It's so important that you seek out help. Not just any help, but persons who are trained and certified, so you can get the right help that you need. Thank you for joining us on this episode. Take care of yourselves and others. Bye.